I'll try to remember. You got to remind me.
How tall are you?
Okay.
Okay, and I'm 5'2",
All right.
so you can lower that thing and it'll be just fine for me, so if you need it lower. Okay.
All right, we're going to be going live so everything on. Good afternoon. Thank you for joining us today. We have a few community updates on today, March 25th. Up first is Mayor Sarah Karen.
Thank you. Fortunately, when we started planning for this virus event a few weeks ago, we were able to use a previously prepared pandemic plan that we already had. We only needed to update it. Our plan identifies an organizational structure called the Unified Command Team, identifying key individuals in dozens of roles, including both physical and mental health care, public safety, funeral service, business, schools, finances, logistics, managing volunteers and donations, working with other governmental agencies, and more. The incident commanders leading this team are me, the mayor of Watertown, Casey DeBoer, CEO of Prairie Lakes Healthcare System, Cindy Midland, Samford Clinic Director of Clinic Operations, Jim Vockel, Chief Administrative Officer from the Brown Clinic, Doug Kranz, Watertown Fire Chief, Lee McPeak, Watertown Police Chief, and Brad Howell, Sheriff of Cottington County. Each of us has a backup person for our position in case we are unable to serve. We have a plan and we're carrying it out. Our command team is meeting frequently, sometimes several times a day. This being a medical situation, the medical professionals on the team will make it known when it is time to take another step, and then we will. Our goal is to slow down the community spread as much as we can to keep our healthcare professionals in control over COVID-19. We're doing everything we can to maintain control and get us back to 100% as soon as possible. The City of Watertown has added the emergency resolution and ordinance passed earlier this week to our website. There's been confusion about which businesses have been shut down by the ordinance that we passed. We've posted both the resolution and the ordinance on our website for people to read for themselves. We did not shut down all non-essential businesses. Please visit our website at watertownsd.us and click on the COVID icon at the top. That will take you to all of the COVID information, including links to the Facebook site, the State Department of Health website, the CDC, and the 211 Helpline Center. We will do our best to keep that site up to date. Thank you. Next up is Cindy Midland, representing the healthcare community.
Thank you, Mayor Karen. Again, I'm Cindy Midland with Sanford Clinic Watertown. Speaking on really behalf of the community's health care, this is something that we have discussed with all of the entities in town. Today, wanting to focus on workers, specifically speaking to business owners, employers, because we're seeing a lot of workers being sent to our clinics and to the hospital, requiring that they get testing before they can come back to work, even if they've not been exposed to someone who has been tested positive or suspected, even if they don't have any symptoms. So the issue that we wanted to clear up was provide a little bit of information on that, and then we will be posting on the site a location that's just for, it's not just for workers, but it really works for everybody, but for employers to really talk about return to work, or yourself, is it safe for me to return to work? So I guess I would say to the employers, if you have a worker who is symptomatic, and this would include a fever, which is what we're looking at is 100.4 or higher, body aches, cough, and shortness of breath, they should be encouraged to self-isolate and contact their primary care provider. And at that point, have further evaluation. We always want you to call first, and we can talk through some of your symptoms and triage. And a determination will be met whether they meet the criteria for being tested for COVID-19. So it is not something that we do upon demand. We follow all CDC and Department of Health guidelines. Please do not put your employee in the position of requiring that they get a COVID-19 test before returning to work, because that may not happen. Testing is based on medical criteria and evaluation by a clinician and is not available upon request. If you have a worker who has been exposed to a confirmed case of COVID-19 but is not symptomatic, they should contact their primary care provider for further guidance. I would add, for those workers returning from a cruise or a high-risk travel location, we advise isolation, which I will discuss in more detail, at home for 14 days, even if they are not symptomatic. Again, that would only be for those workers returning from a cruise or a high-risk location. I would also like to discuss isolation versus quarantine, and those things are thrown out a lot, and a lot of people think they're interchangeable. They are not. It's an important distinction, and it's set by the CDC, so everybody's using the same terminology. As I mentioned, we'll post the link. Isolation separates people who are already sick with a contagious disease to see if they become sick. I'm sorry. Isolation separates people who are already sick, right, so that they, to see if they, as they get better. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. I'm sorry, those that were in isolation are those that are already sick, to keep them at home for a period of time until they meet the criteria to return to work or return to being outside of their home. I apologize for that. So individuals with confirmed or suspected COVID-19 who have stayed home isolated, or influenza, we're doing the same thing with that, can stop home isolation under the following conditions. You can leave home isolation after all 3 of the conditions are met. You've had no fever for at least 72 hours, that is 3 full days without a fever, without the use of medicine that reduces fever. And you have improved respiratory symptoms, for example, when your cough or shortness of breath may have improved, and at least 7 days have passed since your first symptoms appeared. If you have a fever with cough or shortness of breath but have not been exposed to someone with COVID-19 and have not tested positive for COVID-19, you should stay at home away from others until 72 hours after the fever is gone and symptoms get better. The healthcare community is following CDC, Department of Health guidelines, and we ask that you be mindful of that. We have a lot of people who have not been sick who are told to stay home for 14 days. If it meets those guidelines, yes. If somebody who's been sick, that's where we have those 3 rules into place, and I think there are a lot of people were still applying that 14 days. We are using what I had mentioned, 3 things, that no fever for 72 hours, and you've improvement of respiratory symptoms, and you've gone at least 2 days without a fever, not using ibuprofen or Tylenol. So, thank you.
Thank you, Cindy. So the last update today is something I'm going to read on behalf of the Watertown Dental Society. This public service announcement reads, following the directives from the American Dental Association, the Centers for Disease Control and Prevention, the South Dakota State Board of Dentistry, and the Governor's Office, the Watertown dental community will be limiting patient care to urgent and emergent dental appointments only until they receive further instruction. All non-essential routine dental appointments will be rescheduled until further notice. These actions are to support national efforts to fight the COVID-19 pandemic and ensure the health of others stays well. Although your dental provider's office may have reduced hours during this time, rest assured, as the Watertown dental community, we will work together to cover your emergency dental needs. We appreciate your understanding, and we will continue to monitor the status of the COVID-19 situation on both the national and local level. All right, are there any questions today for our presenters?
Sarah, in regard to the business closings that take effect tomorrow, you mentioned that not all non-essential businesses will have to close. If you get a report from someone that a business is open that should not be open, what will happen?
The law enforcement officials in our community will take care of complaints like that, and they'll do an investigation.
Do they just get a verbal warning that, you need to comply here?
No, we actually have some enforcement that we can do.
Okay.
The ordinance covers that, and I'll just read it. Any violation of this ordinance is subject to the general penalty provision of section 13.0101, penalty where no specific provision of the revised ordinances of the City of Watertown, which states, wherever in any of the ordinances of this city in which any act is declared to be unlawful, illegal, or is prohibited, there's no other penalty specifically provided for the violation of such an ordinance. A violation of any such ordinance shall be punished by a fine of not more than $200 or by imprisonment not exceeding 30 days or by both such fine and imprisonment. Each day a violation of this ordinance is allowed to occur is considered a separate offense.
I'm guessing you will expect a lot of self-compliance. If businesses know they have to close, they're not going to challenge this.
I do expect compliance, and we've already seen compliance. This isn't even taken effect yet, and most of our community is already working very hard to comply. And if we can see that a business is attempting to comply, we're not going to come down heavy. We're going to help them to come into compliance. That we're more concerned that they comply than punishing them for not complying.
Mayor, I know it's early into the event here yet, but have you been in contact with state officials regarding federal dollars that could be available to assist the City of Watertown?
I haven't.
If so, can you tell me how that is working?
Yes, I personally have not been in contact, but I know that many folks in our community are in contact with our representatives and helping to understand what's going on and what will take effect. Our city attorney is keeping track and will keep us up to date on everything that we need to know.
Are you surprised we're just at one case in Cottington County yet?
I'm glad. I don't know if I'm surprised. I am. My heart is warmed by the voluntary compliance that we've seen all throughout our community, and that's what it takes. We can knock this down, and we can keep it down low if we continue to act proactively like we are. So no, I'm not surprised. I'm glad.
We are bending the curve, it appears, and if tomorrow we wake up and there's a couple more cases, is that going to change anything in the city as far as current operations?
Not necessarily, but absolutely we'll pay attention to it, and the medical professionals will tell us when we've reached a point where we need to do something else.
I know this may be a long way down the road yet, but when the time comes when things are allowed to start to reopen, whether it be the non-essential businesses or your public buildings, will it happen in stages, do you think, or will everything come back at once? I'm just curious as to how that might work.
I would expect that we would come back up gradually, stepping backwards out of what we stepped in, so that we don't have an abrupt, we definitely don't want to have a second peak or anything like that.
I guess I have a question for Cindy, if we can get her up here. Cindy, you're with Sanford, is that correct?
Correct.
How is communication working within the healthcare situation? How is everything going from that
It's
standpoint?
great. We have created this group that Mayor Karen talked about. We have different ways to reach each other, obviously by phone, email. We're using an app, Microsoft Group, and but we have a lot of face-to-face as well. I talked to Casey DeBoer, who's the CEO at Prairie Lakes, quite a bit because we're on the same campus. And so, for instance, yesterday as they rolled out screening all visitors, patients, visitors, and employees, we coordinated with them to do the same thing. That's not something we're doing at all our Sanford facilities, but since we're connected and our docs are going back and forth, and it's a way of us to be able to continue taking care of patients without being interrupted, we work together to make sure we rolled that out the same. Anything else?
I don't know, I asked this question a couple days ago and it wasn't able to be answered, and I don't know if it will be at this time, but do we have a count on the numbers of tests from Cottington County that are still pending?
I do not have that.
Okay.
I know we get statewide tests, but of pending and negative, but I don't think we get them by
Localized.
individual county. I think the only thing we get on an individual county basis is if it's a positive case.
And also keep in mind that they're going to different labs, so there isn't a central way to count all of them. So initially, all of them went to the Department of Health. Then we started using private labs to get quicker turnaround. And then Sanford and then Avera also were approved to have their own testing done at their own labs. So there's really not a good way to count how many are out there, but obviously right away, as soon as we know, then it goes through the proper channels of the Department of Health.
With Sanford doing its own testing, Cindy, if there was a test done in Watertown, could the test also be done in Watertown at Sanford, or do you have to send it out?
We send it to Sioux Falls because it's very special equipment that had to be tested and shown that it was up to speed and would be equal to or better than what you'd get testing elsewhere. It has to be verified. So, yeah, that all goes to Sioux Falls. We have a courier that goes twice a day, so we get turnaround pretty quick.
You mentioned that you're following the screening procedures that Prairie Lakes implemented today as well. Are there other precautions that your staff is taking because they're around potentially carriers every day when they come in to be seen? Mm-hmm. Are there extra things that they're doing or they're being mandated to do to keep themselves healthy?
Yeah, we, and it's in degrees. I think that's another reason I kind of spoke to employers. I think they might be surprised that sometimes they're expecting more of their workers than we are of ours. We are very careful, but it's very tiered as far as what we're doing. For instance, the people at the front that are doing the screening, they're doing a temporal temperature check. So since they're close enough to that person is masked, but they don't have gloves on because they're just touching that. They're cleaning it off with a disinfectant. The other person who is asking the screening questions is not masked. But if they ask those questions first, if they answer yes to any of them, we mask the patient, we mask ourselves. Depending on how they answer which questions, they may be taken directly to an isolation room. They're asked a few more questions, would be completely gowned and donned if you are going to test, if they qualify for testing, because at that point the patient would have their mask either off or at least below their nose so that when you swab, obviously they're going to cough or sneeze, and so you have to have more protection on the healthcare worker in those situations. But yeah, there's
And you have adequate supplies
Yes,
to
we
do
do.
the protection measures?
Yeah, I think we're doing a really good job of not only having a good supply, but being good stewards of what we do have. You know, a lot of patients we have that say, can I have a mask? Can I have a mask? Well, if you're not coughing or sneezing, we're not going to give you a mask. But we do have them sitting further apart, just like we're doing here, and a lot of those kinds of things. So we're doing all the right things to keep our patients safe, to keep our healthcare workers safe, but also being good stewards of the PPE.
One last question, Cindy. I had it in my mind, and now I forgot what it was. It'll come back to me later, I'm sure, but thank you.
All right, thank you.
Get Jennifer up there. Jennifer, a question for Prairie Lakes Healthcare. Today is day number 1 for the new, basically screening for visitors coming into the hospital. How's that working today?
Well, from my perspective, I wasn't on the team that implemented that measure, but I went through the screening myself, and I thought it was pretty slick. They checked my temperature. I was 98.6 and answered some questions and got right through it. So I think it's working pretty well.
Cindy, I remember my question now. Sorry to make you get back up. Yesterday, when KC was here, he talked about the screening that's taking place now. Mm-hmm. Has your staff been very open and welcome to that, and they're comfortable with coming in every day and going through the procedure that Jennifer just mentioned?
Yes, they are. As a matter of fact, it was first brought up at our medical staff meeting on Monday, and they were very supportive of it. We gave staff indication that we were going in that direction, and like Prairie Lakes, we limited the number of entrances and exits, so it was easier for us to have just fewer stations to do that. I haven't heard any feedback. I think in many ways, especially our front staff, our registration staff, are very happy that we're doing that screening for all visitors. Employees, I think, you know, we know and we take care of each other, but I just think no one has an issue with it because it's the right thing to do.
Mm-hmm. And Prairie Lakes, I know, has postponed some elective procedures for the time being to focus on what we have at hand. Is Sanford not doing some things that you'd normally do to focus on this virus?
Yes, and also to save on PPE. So yeah, I mean, it's twofold. Yes, we are restricting non-essential surgeries, and there's a very measured approach to that. There are some things in some cases would be elective in that it's screening, but that same procedure might become diagnostic depending on what their symptoms are, if they've had some issues in the past. And so some of those really depend, and so there's some of those in the gray area, but Sanford laid out some really good procedures and kind of some questions to go through for our surgeons and physicians. So I think it just makes sense. And we aren't bringing people in that don't need to be screened and don't need to have that test done right now, and yet are not put at risk by waiting, say, 3 months or 6 months.
You mentioned at the top of your comments a couple of websites that people can go to find out differences between self-quarantining and isolation and
Yes.
things like that. Where would they find that stuff?
That's going to be posted. It is on the Department of Health's COVID-19 website.
Okay.
They can search around. I don't know exactly it is from the home page, but we're going to post that specific page. Okay.
All right.
It'll
Thank
go on
you.
Conference. Yeah, thank you.
I have no further questions.
All right. Thank you, Mike and Troy, for joining us today. And